All right, why don't we get started? We have just about 20 people joining. So maybe I'll just kick things off and say thank you to everyone for joining. I think we, between the WHRI and BCCHR, we've all encountered quite a few questions about how to pivot with recruitment of research participants in this new era of conducting research in a pandemic. And so between our institutes, we're very, very excited to have Stefanie Chia here today, who is the project manager for Reach BC. Before I hand the mic over to Stefanie, I just want to acknowledge that both the WHRI and BCCHR operate on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Musqueam, Squamish, and Tsleil-Waututh nations. And I'm sure that all of you are not necessarily on that at that geographical location, but do be mindful of where we're located. So just for those who are joining right now, I'll be handling the chat box, so feel free to put messages in there or send them to me directly. And I will hand the mic over to Stefanie. Feel free to share your screen.
Thank you, Nicole. And thanks everyone for joining this morning. Great, so I'm just going to share the screen now, so let me know if it looks all right. That's the wrong screen. Okay, everyone can see the PowerPoint slide? Great. Yeah, thanks for the introduction. I'm Steph Chia, the manager for this Reach BC platform, which was developed as a demonstration project of the BC Support Unit. This platform actually was in development for over 3 years. Like, I think it began at the end of 2016, so we've had a long time to come where Reach BC was launched earlier this year in end of April. But we're happy to share that it's live now, and we really are trying to let the research community know that this is a tool that can be used to help you with your recruitment for both research participants and patient partners. So today I'm just going to go through a little bit of a slide deck that gives you a little bit of the history and around what the Reach BC platform is. And then I'll pivot to an actual demonstration of the site and show you how you would be using it, creating accounts and finding interested volunteers in your project. So Reach BC, it's a new online platform that the purpose of it is really to connect British Columbians to health research opportunities in the province. I mentioned it is a demonstration project with Support Unit. We also received funding through the BC Academic Health Sciences Network, as well as some previous funding from the Clinical Trials BC predecessor, which was BC CRIN. And over the last 3 years, we were in a development of what should this platform look like, and that involved a provincial working group, which Nicole was a part of, as well as Elodie Portelis Casamar from Children's, and we had input from the various health authorities and universities, as well as conducting several community consultations across the province. So we did little community dialogues, we called them, and gathered feedback from the public in different areas of the province. And so if you haven't seen it yet, the website is reachbc.ca, and hopefully by the end of this you'll be well aware of how to use Reach. The reasoning the reason behind Reach BC and why it was developed really stemmed from I guess a problem that researchers as well as the public were experiencing, was that there was a number of people interested in participating in health research. A public survey of these British Columbians showed that 70% of British Columbians actually wanted to hear about research opportunities, but unfortunately only 15% of them were aware of current opportunities to participate. So that was a large gap that we were trying to address. And at the same time, researchers were, there's always recruitment struggles of trying to find enough eligible participants for your project. It can rely heavily on resources and funds to market your research project, and we thought that there should be a better way to connect both these groups, and that's how the Reach BC platform was developed. This is a photo I took, I think it was at Children's and Women's actually, of the participated in our research board, just to show this is one of the methods that researchers can use to try to find participants for their projects. So putting these recruitment posters up on these bulletin boards, hopefully the right person comes along, meets the eligibility criteria, sees the poster, and rips the phone number and contacts the researcher. And that can work, and I think it's still one of the good tools that can be used. But we were thinking that we should take this idea of this bulletin board and put it online so that you have a wider audience of who actually sees that poster. So that's what the ReachBC platform is. We have an online directory of research projects that have been reviewed by our team as well. They all have their ethics approval, so we post them on ReachBC, and it's a searchable directory which has a search bar. You can search by health area or health topic, and then we are able to show people what research is currently looking for participants. And this is for all of BC. And how people can get connected to those research projects, they can either search through that ReachBC directory, or they can also sign up to be a ReachBC volunteer, we call them. And that means creating a profile and giving us their contact information. They will tell us what their health research interests are, so they'll select from a menu of topics. And then based on their eligibility for that research project, we will match them to specific research projects that are in our ReachBC directory. And then we notify them by email to say, here are your research matches this week. Please log in and review them. Once they review the details of the research project, they can decide that they think they're eligible, they're interested, and they can ask to be connected to the researcher by clicking a button that says, I'm interested, contact me. And then the platform will connect that volunteer's contact information with the researcher. This is the menu of research topics that we have. So each one of these is a parent category that unrolls to show the subtopics, and I'll show you what we have when I do the live demo. But you can see we have like a child and adolescent health category as well as women's health category there, which would probably be relevant to everyone here. But we have a lot of categories here, and the volunteer can pick and choose what they want. So we know a lot of people aren't necessarily only have one health condition, so this is how we can meet their needs to show that they're interested in women's health, but also in, they have a heart condition, and we can match them to all these projects based on their profile that they create. This is a snap view of what the research study posting would look like on ReachBC and what the volunteer would see. And this is, so we ask for the study purpose and some details, and then we ask the researcher, you, to self-categorize your research project, tell us what the age eligibility is, sex, gender, and some additional information here. But here's the buttons that the volunteer would get to see to say they're interested and when they want the researcher to contact them. I also just want to mention we are working on some methods to help with COVID research recruitment. When we launched in April, that was one of the main focuses of our platform, was to help COVID research recruitment. And we partnered with the Center for Disease Control in order to really let the COVID patients know that ReachBC is a platform they can use to find COVID research. So there was a process that was run in the summertime that the CDC called each COVID positive patient and asked them if they wanted to be contacted about research, and explained to them, if they said yes, that their information is being shared with ReachBC, our platform. So we were able to create accounts for those patients who had email addresses, and that process is going to be restarted soon. I believe it's just we had to pause in the fall because the resources who were responsible for calling the patients were volunteer medical students, and they had to go back to school in the fall. So that's the one process that we're working on to let COVID patients know. But the others that we're pursuing right now is to have ReachBC posters at the COVID testing sites. So we're just getting approvals from the different health authorities if we can do that, as well as there's online COVID test appointment booking forms, which we're hoping to put a button or link there to say, like, are you interested in COVID-19 research? Click here, which will give them information about the ReachBC platform. And another last one is that we'll be working on a media press release that we'll showcase some of the COVID research projects we have on ReachBC, and hopefully that the media will pick up on those and then share that throughout their channels. So here is just some metrics, I guess, from when we launched at the end of April of how many users we have. Right now, we're almost at 1,500 volunteer users. We haven't, and so some of these jumps in numbers were from, we had some media coverage from CBC that wrote an article. I was on a radio interview on the early edition, so I think that some of the public picked up on those events, and we saw a jump in signups. And then researchers, we've had kind of like a steady increase as I've been going around doing presentations to the different research institutes. Nicole.
Sorry, I'm just going to ask, I think, Marie and Manny, do you guys mind muting yourselves, please? I apologize, I can't mute you in the current Zoom setup.
Okay, thank you. Yeah, so we have almost 1,500 volunteers right now, and for researchers, I think we're just over almost at 300 researcher accounts signed up in ReachBC. And the demographics of our ReachBC volunteers is about 65% female, 34% male. I think that's pretty consistent with other types of research platforms or projects where it tends to be females more likely to sign up in these types of platforms. And our age distribution here is that we have between the 20s to 60s is the majority of our ReachBC volunteers. Where they're located, almost 70% are in the Lower Mainland, and then the next biggest region is the Vancouver Islands region. We are hopefully going to do some better promotion in the north and interior to just kind of get those numbers up, but Lower Mainland is the majority, and that Lower Mainland includes like Vancouver and the Fraser Health region, Vancouver Coastal and Fraser Health. Just an idea of where the researchers are from. We have about 56 from UBC Vancouver, and then UVic and other universities. So this platform has actually been picked up quite a bit from some of the smaller universities, as I think it's allowed them to have better reach to find these participants, which is kind of neat to see that some of these non-UBC researchers are able to get their studies and get people enrolled in participating in them. This is just a overview of the types of research projects we have. I think I didn't really go through it yet, but not only can you post your research study looking for participants, but you can also look for patient partners through ReachBC. So there's two types of opportunities you can post. The patient partner opportunity would be when you're looking for a patient to lend their voice or provide their experience on your research team to help you design or carry out your research experiment, your research study. We also partnered with the support unit, of course, to provide resources or support for any researchers who are new to patient-oriented research, that we connect you with the appropriate support unit personnel if you need additional help on like how to work with patient partners. So but majority of our projects, 52% are research studies, and then the rest would be the patient-oriented research. And I think as we go forward, as patient partners are increasingly almost required to be part of your research team, that we'll see more of those patient partner opportunities coming up. Okay, so I'm just going to switch screens to the actual site now so I can show you a little bit about how people sign up. Okay, so we're on the ReachBC website. We have some nice graphics that were created for us from a marketing agency. But we basically, the site is explaining like why is it important to participate in research. If they've ever wanted to be involved in research, they should sign up in ReachBC so that we can let them know what opportunities there are. We also explain the difference between the research study, participating in research study, as well as patient-oriented research opportunity to be a patient partner. I'm just going to show you the Find Studies tab, which is our ReachBC directory search bar area. and then we have like some quick links to show COVID-19 research studies or all studies. I think currently we have almost 50 studies or opportunities posted on ReachBC. And this is what they get, as they're searching the public directory, they get a little snap preview of what the study is with the headline here and then the categories that the study is categorized as. And then if they click learn more, they get some more details about what's involved, where it's located, when the recruitment end date is. And then if they want to see the full details and get connected to the researcher, they would create a ReachBC account or log in to their ReachBC profile. So I will just show you the sign up button now for if people are wanting to create a ReachBC volunteer account. So I'll just create that now.
Stephanie, while you're doing that, can I ask, in the actual overview, I noticed that it said location British Columbia. Would other projects be more specific about their locations if they were at a hospital or something?
Yeah, you can, it will show the city of where, if there was an address put into the study, it will show what city was entered in. A lot of these projects are online projects, so they are actually, the scope is BC-wide, but it will show the city. So we ask for the volunteer's first name, last name, and then we collect their phone number. They have to select the location of where they are. So we have the BC's regions, and they can select from here. Then they have a preference. They can specify their willingness to travel. So they could travel to any region, or they could travel to selected regions, or no travel, which means that they only want to see online or phone mail opportunities. If they selected travel to my selected regions, then we give them a checkbox saying I'm willing to go to these 2 regions here. And then the types of research opportunities they're interested in. They want to be a study participant, just find studies, or patient partner. This is a piece called registration site code. So pre-COVID, we had an idea to create these registration sites where patients coming into like health centers or clinics would be asked if they wanted to join ReachBC, if they're interested in research. And this would allow our partner, the registration site, to enter in their specific code that would show them this patient at my site joined ReachBC, and there would be a site administrator who could see that list of people just to know that like, these patients were signed up at my site. It's not meant to be a standalone permission to contact type list because the platform will do that for the researcher. We will automatically match these patients based on the eligibility criteria and our matching engine. So it's really, this registration site code was just to help site administrators determine, like, has this patient already been signed up in ReachBC? Do I have to approach them to introduce ReachBC or not? But that hasn't been active right now. We are, because of the pandemic, we know that things have kind of gotten a little turned upside down. So we'll hopefully have that implemented again when the time is right. That was one of the main methods we were hoping to sign people up as ReachBC volunteers. So it's there. It can work as long as the sites are ready to do that. So we collect the date of birth, enter in here, and then the sex and gender are both required fields, but they can choose to decline to state for both of them. If they do choose decline to state, they would just get not matched specifically to the sex or gender eligibility. They just get everything, either female, male, or any of the genders. Yeah. And this is a multi-select, so they could select more than one gender if they identify that way. So here is the piece on parents and guardians. So if someone was looking for their child, they could select this field, which then we ask them to enter in their child's birth year. And this is for our, just to track metrics-wise of like, are their parents using this project and what are the ages of the children? We don't match on the child's birth year for the matching engine to work, but by selecting this button, they will be shown an extra category here. So this menu of the child and adolescent health category doesn't show up if they don't select the parents and guardians. Nicole?
Sorry, Stephanie, we just had a note in the chat. Are you able to increase the font size in your actual browser? Yeah, awesome. Is that better, folks? Just a thumbs up would be good.
Is that good?
Yeah.
I can go bigger if you want. I don't know. But, okay, let's try that one. So as I mentioned in the slides, each one of these is a drop-down menu, and the volunteer can select as many categories that apply to them and from the different fields. So they could be selecting for their child under this category, and that's how we'll match projects that are looking for children. So these categories, and then outside of that category could be for the parent. So once they select all their health categories, that's the end of the sign-up form. We just ask if they want to receive news about ReachBC and then complete the CAPTCHA, and then they have their account created. Okay. So I will not complete the form, but I will log into a ReachBC volunteer account now. So I can show you what happens when a volunteer logs in. This is the volunteer dashboard, and when you log in right away as a volunteer, you will see the matches appear immediately, because that matching engine will automatically look through the profile and match based on the profiles, the age criteria, sex, gender, location, and the health research categories. And we'll put the opportunities on the person's dashboard, and these will be emailed to them on a weekly basis if they haven't logged in to take action. So when they see a research study appear on their dashboard, they can click on it and then read through the details. So we collect all these details, and I'll show you the researcher form in a little bit. But when they think that they're interested in this project, they would click this button. It says, "I'm interested, contact me," and then we tell them your contact information will now be sent to the research team to follow up with you about this opportunity. When they click OK, their information gets sent to the researcher. Okay, so now I want to log in as a researcher, and I'm just going to use our test site to do that. So that there won't be any real patient data on this site. When you log in as a researcher, I haven't shown you the researcher creation account form, but it's very short. We just ask you what's your email. You create an email login, and then who you're affiliated with. And we do ask for your mobile phone so that we have two-factor authentication for researchers. This is because researchers, you will be accessing personal information through your ReachBC dashboard, and we want to make sure that it's as secure as possible. So I'm logged into the researcher dashboard. I need to zoom in a bit. Is this good? We have these two buttons at the top that show you the two forms that you can access. So it's either you want to submit a research study to ReachBC or a patient partner opportunity. They're a little bit similar, but the research study one is expanded because there's a section about ethics. So after you've created your ReachBC account, you can access this form, but your principal investigator also needs to create a ReachBC account because we asked for their information here. And when when you search for you're searching for the PI's email here. So I've put in my email which has been designated as a principal investigator account. But if I put in a new email that's not recognized by the system, there will be an error message that just says you need to ask your PI to create their account, as well as there's a manual validation step, verification step that we do as the office to make sure that this person who's designated as a PI actually is a faculty member or affiliated with the health authority or university. So that would take like 2 to 3 days at most, I think. So you just need to wait for that to happen before you can proceed with this form. There's a section for additional team members. So if you have more than one research coordinator on your team, you can enter their email here. They would also need to have a ReachBC account because this is also a lookup. So you're looking up someone's email. And if they're not there, you'll get an error message. This person will then have access to the exact same dashboard view of the study once this form has been submitted. So we ask for your study title. This can be like your full study title on the ethics application. And then we have a lay study title, which is a shorter version and hopefully more lay-friendly. And then we also have a study headline. So this is the catchy, very short headline that what the volunteer sees when they first click on your project. So we kind of want it to be enticing for them to find out more about your study. We ask if you have a clinicaltrials.gov number, who's funding the project. So there's a drop-down choice here. Our recruitment end date. So that's to let the volunteers know how much time they have before they need to respond. Then the section on study location. So where will the volunteer need to go? You can say that this is an online phone or mail opportunity, which means that it's open to anyone in BC. It doesn't matter where they're located, or you can say there's a physical location, and then you select one of the regions, Lower Mainland, and then you can enter the address of where you want the person to go. So we have children. I think it's there. We'll have to find it in the drop-down menu. Children and women's are both there. Then we go into the study details. We ask for the study purpose. We like to keep it short just so it's as user-friendly as possible. Use lay language. What's involved, what are the logistics behind the study. You could explain that they need to come into the center 4 times, or that you'll be doing a survey plus some procedures, estimated commitment, so how long is the duration of the project, how many times you need to see the participant. Are procedures required, yes or no? If yes, please describe what the procedure is. If compensation gifts are offered, the yes or no toggle. So I know some studies are allowed to specify what the compensation is, and if it is, then you can put that in the what's involved section. But I know some ethics boards do not allow that, so that's why we haven't made it specifically specify what the compensation is. And then whether other expenses are reimbursed, you can select the yes or no. Then we'll go into the eligibility criteria. So we ask for age requirement, minimum and maximum age range, and it's in months. You can choose months or years. Are healthy controls eligible, yes or no? And then the sex and gender eligibility, which is the same menu that the volunteer had, except for the decline to stay is not here because they get everything. Then we end with the inclusion and exclusion criteria, and then the health research categories menu. We also ask some information about the target sample size. This is not displayed to the volunteers, just for our own internal metrics to see how well we're doing with helping researchers with their recruitment. Then there's 2 study contacts that you can enter. So these would be publicly shown on the posting to say, so if someone had questions they wanted to reach out to you, instead of waiting for you to contact them, you can put your up to 2 contacts here. And then at that point, if you haven't, at that point we recommend that you actually submit your project for review. So we do look through your description of your project and recommend like maybe some health category selections you might have missed, or rewording the lay title or headline to be more eye-catching. And then we will then let you know how to proceed with either finishing off your ethics application or amendment to share that you are going to be using ReachBC as a recruitment tool. I think all the REBs are aware of the ReachBC platform and understand the process, but they do ask to see what your study language is, the poster language. And so you just generate a preview of your study project, and you submit that as part of your ethics amendment or application. And once you get approval from ethics, we ask that you kind of upload that certificate here, and then any additional supporting documents. Lastly, there's a comments field. This is when you want to let us know, like, oh, we're in the middle of an amendment approval, or you've made some changes and you'd like us to review it and approve it again. This is like your internal communication with our ReachBC office. Okay, so
Stefanie, is this an okay time for some questions? There's a few folks.
Sure.
Sav, so in their lab they study infants, 6-month-old babies, and Stav is wondering about the way to, can the system match to a family, not just the infant or the person that would be requiring the parental consent?
In order to match to an infant, the volunteer, the ReachBC volunteer, would have had to sign up and select one of the child and adolescent health categories. So as long as they've selected something under here and your project is also has the same health category selected, it would match, and it doesn't matter what the date of birth is of the person who created the account. So this kind of overrides the age criteria matching. So the parent or guardian who created the ReachBC account would receive any projects that they selected under here, no matter their age. And hopefully they would review the project and say, oh, I do have an infant that meets the this specific project's age eligibility, and them themselves as a guardian would be seeing it, and you could contact them about like family member, or if they themselves need to participate in the study.
Did that answer your question? Awesome, thank you. Love the thumbs up function. Lindsay, do you need an institutional email address to sign up for the account as a PI?
Yes, yes. There is a, we do ask that researchers use their employee emails. You're not allowed to use your personal Gmail or other non-employee emails. So we have a whitelisted email domains, meaning like you're only allowed to enter specific emails for researchers, but we can add additional domains, email domains that are approved if it's appropriate. So we've had to enter like some additional centers, research centers, and the email domains. So I mean, CNW and Children's and UBC, they're all approved already.
So Lindsay, it looks like you were looking at a contractor's email address. Is it specific? Because I mean, even from an ethics point of view, I know that we usually just have institutional emails. But do you want to expand on that? Lindsay, you are muted in case you...
Sorry, I was going to type it in, but I can just say it here. So all of our contractors use their personal email accounts, but we are project leaders, research managers, and things like that. So it's absolutely fine to have our staff exclusively attached to ReachBC. It's just an awareness from my end that, let's say myself as the manager, wouldn't be able to get an account because I don't have an institutional email.
Mm-hmm. And would you be the person that's contacting the potential participants and consenting them?
Yeah, it would be myself or one of my other colleagues who's in this training, but it could also be linked to our PI. So it's really not an issue. It's just a matter
just awareness. Okay.
Yeah, of awareness from our end.
If that's something that comes up as maybe more research projects might be using external contract services to do some of their recruitment, I think that's something we could look into as how to address that need.
Okay, that's great. Thank you so much.
Awesome. So next question is from Kelly. So with COVID procedures, we go to the participants, so they don't need to go anywhere. Is there a drop-down menu for that option?
For that one, I would probably just select that this is an online, even though it's not online. Maybe we could just adjust that it also applies to like no travel necessary, basically. This is what that button means. I could add that text to just say no travel necessary.
Yeah, hi, this is Kelly, because it's quite extensive in terms of the visits that we do to participants. So I could see that the no travel necessary, but it's definitely not online because we're getting samples and that kind of.
Yeah. Well, in that case, you just have to need to write that in the estimated commitment of like the number of study visits or what exactly is involved in the logistics section as well.
Okay, thank you.
Ariadna, so can we get a draft to submit to our rep? So I think I understood, Stephanie, that you can actually populate the content in here and then preview it, and is that what you submit to Ethics?
Yeah, yes, that's right. So once you fill out this form and click the Submit for Review button, it won't go live yet because there's like a review process and we internally, it would show up as pending approval here. So that one's the patient partner opportunity. So let's check here. This is what it looks like after you've clicked the Submit button. Everything would be filled out. And this is where you can share this with your ethics board. So for this, we ask you to create like a PDF view. So this is, you could save this as a PDF and then attach that to your ethics amendment. The ethics board also sometimes usually asks for what will be your verbal script or email script. We provide you with both the phone number and email, so it's whatever you're approved to contact the potential participant. You can create an email template script of like, this is the email I will send out to these potential participants, or this is the phone script I'm going to use. And we have some templates that you can adapt to your own study. Our text that we give you is just basically telling the person that you're reaching out because you connected to them through ReachBC. So all of those are available under Researcher Resources. So when you log in at the bottom, there's this menu here that you can, link here you can click, and then these are all of our standard operating procedures and documents. What I've basically run through with you today is this general SOP, how to use ReachBC, how to create your account, how to submit a study or a patient partner opportunity. Then we have additional SOPs like how do you contact volunteers for follow-up, and then some language. And then this one would be important for you as well as the info that ethics boards are asking for. So that includes the study preview, recruitment poster preview, as well as the scripts.
Ariadna, did we answer your question with the process? Because it sounds like you also wanted to know about how the communication between the REB and ReachBC approving it. So it looks like we actually have to upload the approval certificate to ReachBC before it initiates.
Yes, that's right. So I ask for either the certificate or amendment that shows that you've told the REB about that you're using ReachBC and they've already seen your poster.
Yeah. Awesome. And it looks like, I mean, I see a lot of those fields look like what we already put into the RISE system. So that's quite nice. Okay, yeah. Michael. Oh, sorry. Go ahead.
I just want to mention there is like if you want not ready to fill out the complete field, unfortunately we don't have a draft saved, so you can't stop halfway through the collection, but we do have a fillable PDF that you can kind of look at what the form looks like before you're ready to complete the field.
Oh, so Michael, does that answer your question? I think that may be sort of the template. Very intuitive, Stephanie. Awesome. Okay.
I mean, also for Michael's question, if that person that you want to share your project with is an additional team member, you can add them here. So once you save the form, submit for review the form, they will see this exact same like project on their dashboard pending approval. And you can also put in the comments field that you're not ready, like you're still making changes to the form or something, and then update that when you're saying, okay, we're ready for the ReachBC office to review, or we're ready to like go to ethics for ethics approval. Great. All right, so I'd like to show you how you find the interested volunteers who click the button, I'm interested, contact me. So I'm going to click this specific study because I know there's volunteers on this list. You click on your study, and then you can either, this is where you can see your status of was approved, and then the edit button will take you back to the form view where you can change the fields. But you can see there's this details tab, and then there's the manage volunteers tab, and this is where you find those volunteers. So we'll populate these people. As soon as they click the I'm interested, contact me button, they will show up on this list. We have a volunteer ID here, first name, last name, date of birth, email, and then phone number, and then the gender that they was selected. And then we have a column called follow-up status. This is both for helping research coordinators track who they've contacted to follow up and consent them, or also for us as the Reach BC office to manage, to find out how well we're doing with helping you with your recruitment. So everybody shows up that have not been contacted, and then the drop-down menu goes through the stages of the follow-up. So you might have sent them an email and you're waiting for a response, or you phoned them and left a voicemail so you could leave them on follow-up in progress. And then the two final states of a interested volunteer would either be they were enrolled in your project or not enrolled, and we have a few reasons why. And that really will help us with our metrics to determine how can we improve our system, or whether we are really reaching what our goals are, is to help researchers with the recruitment. We are updating additional drop-down options here to be, a lot of projects right now are surveys, and they end up just sending a link to the interested volunteer. And at that point, they don't know whether the person was enrolled or not. So we will have another option that says survey link sent, unknown participation. And then I think there will be another one where it's not enrolled because the project has fulfilled their recruitment activities, or closed recruitment. They could have been interested, but then your project already finished recruitment. So we ask that the researchers come in and check this list on a regular basis. We are close to implementing an email notification that will let you know when someone new has been added to your list, and that will be sent out at most once a day to let you know, like, someone within the last 24 hours has expressed interest, so please log in and check your list. And then we want the researchers to contact these volunteers within 5 business days or sooner if possible, so that they're not left waiting a long time for once they said they're interested, that they connect with the researcher as soon as possible. Are there any questions about that piece? Okay, I can show you the patient partner research opportunity form. It's very similar. It still needs a PI and has an additional team member field, but then we ask what is the patient partner opportunity name, headline, similarly the location and the purpose, what's involved. There's a menu about the level of engagement. So this is based off of the IAP2 spectrum of public engagement, and you can select more than one. So if they just want to inform the public about this research project, or they're going to be consulting on it, they're involved, and it's like an increasing level of engagement for these categories. Whether orientation is provided by your team to help these patient partners understand the research that's being done, any other background that can help inform the potential patient partner about the opportunity, estimate commitments, compensation, expenses, and then the same matching criteria categories here, and the health categories. So in this form, there is no ethics application section, ethics certificate section, but we do still review your project before we post it online. And once the office, the Reach BC office, approves it, then it'll go live on the Reach, and it'll be searchable on the Reach BC directory. It'll automatically find the volunteers, and then on the weekly basis, the email will get sent out with the matches to the volunteer. Yeah, so I think that was all for my demo. Unless anyone has specific questions on the Reach BC live site, I'll switch back to the PowerPoint, which is pretty much the end of the presentation. But happy to show anything else on the site if anyone wants to see anything. Okay, all right. So I just wanted to highlight a couple upcoming activities. As I mentioned, we have about 1,500 volunteers in the platform, but of course we want to have many more people sign up in Reach BC. We had been focusing the initial few months on researchers joining Reach BC and posting their projects, as we wanted the public, to be able to see projects on Reach BC before we do some mass marketing to them. So now that we have almost 50 research opportunities on our directory, we are going to launch a social media campaign, which would run from the beginning mid-December to the new year. We'll be doing Facebook and Instagram ads, as well as some like Google AdWords search. So we're hoping that will really help create awareness about the platform and have people sign up. We'll do a media press release about the COVID research projects that we have in ReachBC. So just to share that we have a lot of interesting COVID projects that the public might be interested in, and then hopefully point them to ReachBC. And the other activities we're doing is just some platform feature enhancements to make things more user-friendly for the researcher or the volunteers. And we are gathering feedback from both user groups to really figure out prioritize what enhancements we want to tackle first. So that's the end of our presentation, and I just want to acknowledge that there were many stakeholders and people involved in the development of ReachBC, including patients and the public, the research institutes and health authorities, and then all of the funding and funders and partners. So a lot of work went into ReachBC, and we really do hope that it'll be one of the useful tools you use in your recruitment. It won't be your replace everything that researchers have to use, but hopefully it will help alleviate or make some recruitment processes more efficient. And we are happy to continue improving ReachBC. So based on your feedback and what works, we hope that this will be one of the main recruitment tools that you use. And especially when we get the volunteers, more volunteers signing up in ReachBC, it could be something that could be very useful and hopefully help you find participants or patient partners quickly. Okay. So if there's any follow-up questions, I'm happy to take them now. But I think just one thing when you sign up for ReachBC, if you haven't already, just make sure that you're creating a researcher account instead of the volunteer account. So we noticed that some people were mistakenly creating the volunteer account, and we're going to have a menu that will be more clear of whether you're creating researcher or volunteer. But until then, just make sure you're on the researcher account, which is a much shorter account creation form. And get your principal investigators signed up, because that's one of the initial steps.
Mm-hmm. Yeah. I think I see quite a few folks. I see Biobank, I see Department of OBGYN, different BCCHR groups. I think the other plug that I may make is, so many of us have communication tools. So Stefanie's got a really great boilerplate language if you want to throw this in, a departmental newsletter, promote to your lab, because this is a real opportunity for us to shift to virtual recruitment. And it seems to me like a lot of the information that we need to put in our ReachBC application is already in our ethics. So,
yes,
oh, sorry. Yeah, go ahead.
Thanks for mentioning that. I didn't really mention we have what we call like a ReachBC ambassador program, which is partnering with institutions or, universities that have a communications team that or channels to distribute materials about ReachBC. We have posters, brochures. I mean, I don't know. We actually have printed posters and brochures that could be distributed, but we also have some language and graphics that could be shared. If you have social media channels, please, reach out to me and we can discuss like what are the different opportunities we can have to promote. We have, this is of course, a government-sponsored project, so marketing can cost a lot, and we do have this small social media campaign that will be run, but of course we want to spend as much money as we can on like the development of the platform, and if we can make use of in-kind partnerships with the groups, that would help us a lot.
Mm-hmm. Yeah, and I think I'll make a note too we do have some labs that have patient advisory boards or patient committees, so I'll definitely flag this for them as well, because I think having that side covered of on the volunteer aspect is equally important. Ariadna, yes, it will be recorded. I should have the recording from FOM in 2 days. Apparently, they send it.
Great.
I'll probably send the recording out to the whole email list. You may get it via the Eventbrite system or our WHRI communications email.
Great. Thank you, everyone. And feel free to email me if there's any additional questions. Maybe you can include my contact information in the email with the recording
Totally. Yeah, will do.
Thank you so much, everyone.